Hi, my name is Nia, and today I'm going to be demonstrating how to insert an NG tube, and also how to irrigate the NG tube. So the first thing you want to do is check the doctor's orders and just determine if the insertion is for suction or feeding. And then what you want to do is just gather your supplies. With me, I have my Salem sump, piston syringe, a little bit of tape, a towel. I'll be using a paper towel as my towel, and some gloves. And for that, after you do that, you enter the patient's room. You just want to introduce yourself to the patient, provide the patient some privacy, and make sure that you identify the patient with at least two identifiers, like the first and last name and their date of birth. Now that you've done that, you place the patient in a high Fowler's position and cover their chest with a towel. Now, once you've done that, you're just going to explain to the patient the procedure that you're going to be doing, which is going to be inserting the NG tube and irrigating the NG tube, and answer any questions that they may have about the procedure. And while you're doing that, another nice thing to do would be to create a head. You and the patient can come to an agreement with a hand signal that the patient can give if the procedure is becoming too much for the patient. So once you've done that, you want to assess the patient for any facial or nasal passage issues using your pen light. And when you're using the pen light, you're just going to, of course, look up the nares, look at the facial symmetry, and just make sure that the patient is ready to receive the procedure. And once that is done, you're just going to measure the tip of the tubing from the nair to the earlobe. So you want to do that. And then once you've done that, you want to measure from the measure down to the xiphoid process of the sternum, which would be around 45 inches to 50 inches, that's where you're going to mark that placement with a piece of tape, so you can know where to stop inserting the tubing. So now that I've done that, what I'm going to do is I'm going to put on my gloves. This this procedure is a cleaning procedure, so I won't need any sterile gloves to continue on. I can just use the latex gloves or non-latex gloves from the box within the facility. Sorry, I always have a hard time putting these gloves on. I think my hands are too big. All right, so now that I've done that, I'm going to lubricate the tip of the NG tube with a water-soluble lubricant. It has to be water-soluble because if petroleum or anything like that is used, that is flammable and can combust. So you don't want that. So make sure it's water-soluble, a water-soluble lubricant. So next, what you want to do is you're going to ask the patient to flex their head slightly backwards. So I slightly flex their hair backwards, I'm sorry. And once you've done that, now you will begin to insert the lubricated tubing within the nair. So when you're doing that, you're going to keep insert. And if you meet any resistance, you just want to make sure that you can use a tongue depressor or a pen light to check for any coiling in the back of the throat, in the back of the mouth, and ensure that the tubing has a passageway to continue on. So once you've done that, If the patient starts to gag, you want to pull the tubing back slightly just to so the gagging can cease, and you want to let the patient rest until you can continue on. And once that's done, you want to continue to push the tubing up the nair. And with that being done, you can have a UAP or a nurse beside you to administer water to the patient. And if the patient can't receive water, you just tell the patient to dry swallow as much as possible to help facilitate the tubing, the insertion of the tubing. So you're going to say swallow, 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 and make sure you do it slow and gently, not too fast, because you don't want to cause any trauma to the patient. So once you've done that, you want to make sure you get the tape to that 45 mark or 50 centimeters, and you want to make sure that you stop there once it reaches the nair. And then once you've done that, you want to secure the tubing in place. You want to make sure when you're doing that, you don't want to let go of the tubing. But for this purpose, I just want to show you that I have my tape here. And you're going to put it right there on top of the nose in a little pant leg pattern. That's the way the tape is going to be situated. And the other half can be taped on the cheek. And just secure that to the cheek out of the way of the patient. Let me get it off I have it on my gloves. Sorry. Just take this out of the way so it won't get in the way of what I'm doing. So I have that taped down and secured. So when you have that taped down and secured, what you want to do is you can secure the tubing you can clip it by securing it to the gown by a clip or with a slip knot. Now what you want to do is you want to connect the tubing to the suction and set it to a low intermittent setting per the doctor's order. So once you've done that, what you want to do is make sure the patient is still in high Fowler's position, and then you want to disconnect the NG tube from that suctioning, and then you want to insert your syringe for irrigation. So what you're going to do is you're going to insert, and let me make sure you guys see this. I have my container here as well, my measurement container. And what I want to do is I'm going to insert the syringe, and I'm going to pull back to about 30 milliliters. There we go. About 30 milliliters. And once I've done that, once I've pulled back the 30 milliliters, I'm going to push it back in slowly. And before you do that, you want to make sure there's no abnormalities within the stomach content, like the color or the consistency. So once you've done that, just know that when you're doing this, placement can be checked by 3 ways. You can do it by asking the patient to speak, by aspiration, or the best way, which is the way that's used currently at most all facilities, is going to be an x-ray. That's going to be the best way to check for placement. Now what I'm going to do is I'm going to place this down here, and I'm going to get 30 milliliters of sterile water. Sterile water or normal saline. And once I have that, once I have that 30 milliliters of sterile saline or water, I'm going to slowly instill it into the irrigation tubing. Into the tubing for irrigation. And when that's finished, you're going to, once you finish that, you're going to, reattach the NG tubing to the suctioning device, and you're going to put it back on the setting it was before, which is low intermittent or low intermittent, or the doctor's order that he prescribed for the suction. And then you just want to inspect the color, the volume, the consistency, and secretions from the patient as far as the procedure goes. And you just want to dispose of your gloves, of course, and perform some hand hygiene, proper hand hygiene. And then you're just going to make sure that the bed is appropriately set. You want to make sure the call light is within reach, and that the patient, if he needs to use the restroom, he or she needs to use the restroom, help them out with that, and let them know that if they need anything from you, to call you with the call light. And before you leave the patient's room, you want to document everything that has happened, and that is it. Thank you.